said, well, you guys have basically gave your voice away to others. And he said, no, it was taken away, but we're taking it back.
AI do everything that doesn't require that person to person. Let's let people take care of people.
Is they started to train AI to lie.
I almost nearly died. My first husband was killed in an accident that I was in. And every day is a gift and every day is not a given.
Well, thank you for joining another episode of the Leadership Lab with Asbel Montes. As you know, in this latest series of podcasts that we're doing, we have been talking from data to doctors and leadership through the eyes of the patient, which is really important. And today, I'm just excited to welcome my guest, who's not only a doctor, but she's also a strong leader. And she's also a woman. And you that know me know I have 3 sisters. And so I love it when we have women in leadership that are leading the way in healthcare. So Dr. Gee, thank you so much for joining me here on the Leadership Lab.
Asbel, so great to be with you. Fun to connect.
I know, and it's been a while. It's been a minute. So for those that don't know, I met Dr. Gee, my goodness, it's been probably 10 years ago or more.
Yeah.
In Louisiana, when I was in Louisiana. And so I'm going to let her introduce herself. So instead of me introducing and doing bios, we all hate our bios and things like that. But I'm going to ask you, Dr. Gee, to take about a minute or two, really talk about, because you have such a unique perspective as a physician leader. And now you are running an amazing company, and we'll get into talking about that. But I want to kind of let the audience know, for those that are viewing this that may not know who you are, to give just a little bit of a background about who you are, Dr. Gee.
Sure, Asbel. So it's a delight to be with you. I am not a native New Orleanian. I am a native of Utah. And I moved around a lot because my dad couldn't keep a job. He was a university president, and I ended up becoming president of seven universities. But my journey into medicine started with my mother, who, when I was 15 years old, passed away from breast cancer. And I saw both the grit and generosity of those clinicians, as well as the beauty of what it means when you're in a relationship of human caring. And I thought, well, man, this is a great career. And so I pursued medicine from that point on, and haven't regretted a minute of it. I love being a physician. I continue to practice. I'm an OBGYN, and really have enjoyed that journey. And subsequent to medical school, I had a career in policy. I knew I wanted not only to see patients in the office, but to manage the systems in which those patients saw me and other clinicians. And so I've had a career that really spanned government. I've been on 2 presidential campaigns, helping to lead policy for those campaigns, a presidential transition team, work for a Republican governor, work for a Democrat governor. In fact, and now my company is helped, who's helped me start it is a man named Joe Lonsdale, who lives in Austin, who is one of the founders of Palantir. So I've really enjoyed both being at the intersection of medicine and politics, but also areas of politics that have great bipartisan agreement, such as we can all agree that children ought to get health care, and we want healthy kids, and we want a healthy America. So those are the areas I've enjoyed. And of course, being in Louisiana now for 17 years has given me an opportunity to not only deep dive here in the state, but then to come out of some of that leadership and do work at the national level. So I'm a recent entrepreneur, but I've always been, as you know, Asbel, entrepreneurial in my activity. So it's just been a wonderful thing. I love being a clinician. I love being a doctor. And it's fundamentally, a doctor is my identity. That's how I see the world.
And I'll tell you this, because I wanted you to spend some time on that, because your story, and you have worked through a process, Dr. Gee, that speaks to me. Like, you cross party lines. You've worked for both Republicans, Democrats, but you've always seen things through the eyes of the patient and the eyes of the children. And I think that's what's really important, that sometimes gets lost in argument, and what we're seeing kind of played out sometime right now in healthcare. Sometimes the patient, we've lost the humanity for that patient. And your company right now, I think it's called Nest Health, correct? That's
That's
really
right.
doing some great work. Tell us a little bit about what Nest Health is. And I want to get into some of the leadership. I've got some questions for you, because we've got data happening right now. We've got doctors really taking charge of the narrative again, which I'm ecstatic about, because I think that's why our healthcare system is broken, because sometimes the doctors have abdicated to other individuals to be their voice, and they really got to get back in the saddle. And I have done some podcast recently with several doctors, and one gave me an aha moment. That was the chief medical officer for the city of Chicago fire. And he made a comment to me that I didn't even think. I had an aha moment sitting in the room with him. And he told me, he said, you know what, Aswell, in this room here, he said, you know what, I went through 13 years of school. I did my residency, my internship, and not one time was I taught one course on healthcare economics. He said, I had to go back and get my master's degree in order to get that. And so he's just an acumen for it. And I'm like, I had an aha moment at that point, Dr. Ginn. I'm like,
Mhm.
that's our problem. Doctors. And I said, well, you guys have basically gave your voice away to others. And he said, no. He said, it was taken away, but we're taking it back. And I'm like, I love it. Every doctor that I'm talking to now. And so when that epiphany happened, and I hadn't talked to you in forever, and all of a sudden I saw something about Nest Health on my LinkedIn, and I said, oh my Lord, I haven't talked to her in forever. And I reached out and we connected, and I'm like, I want to get you on here, because I want the perspective that you have that is very unique, because you've been in so many things. So tell me a little about Nest Health, but I really want to talk about the leadership from a physician's perspective, because I believe if we can have a leadership and a discussion, I call it through the eyes of grace, but through the eyes of humanity, we can fix the issues that are going on with our healthcare system right now, because we've got data, we have the physicians engaged, now we just need leadership.
That's right, Asbel. So yeah, so Nest is, a lot of people don't know this, but half of the children in America are on Medicaid, and about that many of our pregnant women have their care on Medicaid. So, we have a lot of low income Americans. These are children who have and mothers who have higher risk. And so it's even more important in some ways that they get primary care. And the truth is that only 25% of Medicaid patients get the recommended primary care. So there's a system that doesn't work very well for them. And we all know getting our own care, how hard it is to go to a clinician's office. You got to wait. If you got multiple kids, you're waiting for appointments different days. If you need mental health, you go somewhere. If you need if you need physical health, you're going somewhere else. And it's very fragmented. And so knowing that, coming out of paying a lot of money when I was Secretary of Health for this care, I thought, well, what if we had a system that was a one-stop shop for the people that need it the most? Let's go to the home where people live. Let's understand their environment. Let's take care of the people that are not going to clinics, that are needing a different care model, and build that from the ground up using primary care as the focus. And we are now, Asbel, with 50,000 lives across Arizona and Louisiana. We are sending clinicians into the home. Last year, we saw 6,000 kids and parents, and we are growing this company in partnership with Medicaid managed care. So, the model is really, and the philosophy I have is we can't change American health care for the better unless we have healthy kids, right? If we don't have healthy children, if we don't have healthy women,
This
then
is this is
we're at a
so
deficit.
not on the outline of the thing, but you're talking about what you put together for women who do not, like, you're bringing the care to them so they can go through this is part of an initiative of that rural health transformation program to really want to impact that as well. And with your experience in the Medicaid, running Medicaid for a state, also the stuff that you're doing, what are you doing around that perspective of it? Because I know that is front and center for a lot of people that are listening right now, all these different models that are happening. Tell me what you're doing there.
So rural is a really important opportunity, Asbel, because that there is money in this recent budget to support rural transformation. And so Nest is really at the cutting edge of this. I think, recently we went to a meeting in Natchitoches, Louisiana, which you probably remember. It's
Yeah.
where Still Magnolias was filmed. It's a
Yeah.
very rural part of our state. And they brought together companies. And frankly, most of them weren't from Louisiana. None of them were providers like we are. So we are the provider, we are the care. And I think that's a great place to be because what rural folks need is they need someone to care for them. They don't need some kind of thermometer, virtual thermometer put it in front of them or some kind of app put in front of them. They need care. So I think that's where Nest is so well positioned as we are the care. We're also using technology, but we're also the care. So we're not just a fancy technology. And
So,
so I
so
think it's
that
really
that
cool.
would go to the point, and not to interrupt you here, Dr. Gee, because my mind's spinning with what you're doing with the Rural Health Transformation Program. But I just had Dr. Darcy, who is a rural doc that works in the rural parts of southern Mississippi, I believe, a lot in the Delta region. And that's what he talked about. He said, you know what, there's all of these great, innovative companies happening right now, but in some of these rural communities, they don't want to talk to a phone. They want to talk to a clinician. And so while they're augmenting the different technologies through the process, they want an interaction. It's different than providing care in an urban area. It's
That's right.
totally different in a rural. Are you seeing some of the same things?
That's right. Yeah. And even in rural areas, in urban areas, we're used to seeing a lot of people every day. In rural areas, not necessarily. And so it's a little bit harder in rural areas to build trust. You want to know who you're talking to. So yes, we see that. And I think that's why Nest is so perfectly positioned as we build trust. We're in for example, rural Mojave County, which borders on the Grand Canyon. It's very rural Arizona. And so we've been able to do our care model there. But I think the important thing for rural communities is you want the technology, you want the best and brightest coming out of technology, but you also need a relationship. And so what we're doing is marrying, in fact, what we're doing with the rural funds, if we get them, is to take our care team and say, we're going to marry that with technology, with workforce, with, loan payback for people, with infrastructure that allows rural care like buses and vans that might be able to be utilized instead of building clinics. So all of that is part of our strategy, Asbel, but fundamental to it is the people seeing people.
This is what I love about the program because it's creating transformation. It has to be transformative care going, not just doing business as usual. So regardless of what we thought about what happened with the One Big Beautiful Bill, I do think that there is some things that it kind of kickstarted the healthcare industry into thinking we've got to do things differently. We continue to keep executing the same playbooks. From the economist perspective, I mean, the trust fund's going to run out. I mean, you can't literally, the data is the data, whether we like it or not. So you've got to do something different with that. And I love it that companies like yours, Dr. Gee, are really working on transformative care, like literal transformative care in some of these communities.
Well, not only that, Asbel, but we're not only transforming care, but we are what's called a value-based care company. What that means is we don't get paid to do more and more. We get paid for outcomes. And if we don't, achieve those outcomes, which includes savings and quality, we have to lose some of the payment that we get. That's what we contract for. So that's really important is to think about, as you said, there is not an infinite pool of money. We can only borrow so much money from China or print so much cash, right? So fundamentally, we have to get our books in order. And part of this is we have a very expensive healthcare system.
And
Um,
the
yeah.
thing is I had Scott Becker on one of my podcasts, and he indicated something very similar to what you're saying right now is when we were talking about different healthcare financing models. Now, he just said, we got to get back to the basics. This is the law of supply and demand. And it was really kind of a reset for me too, because a lot of us, again, he said, really, Asbel, it just keeps coming back to supply and demand. He said, so the more demand we have, we've got to figure out the supply. We've got to work through that process. And we need to be looking at at value-based care. We need to look at population management. What are we doing through these constructs? And that's what I'm hearing you say. Your company is actually saying, and this comes from what you used to do as the secretary of LDH and looking at, like, we need outcomes. I just don't want to keep throwing money at something and we have worse outcomes or the same outcomes. Is that kind of what you're thinking as your models as you've been developing Nest?
That's right. That's right. And we're actually the first to do this, focus on children. A lot of companies have done this for seniors, and there's a lot of companies that have been out there in Medicare that will go to the home, that will focus on high cost members, et cetera. What's so unique about Nest is that we involve children, and we're the first company in the US that can do the fullness of primary care. And that means newborn exam, the vaccine, the care. But furthermore, we're the family. So we look at healthcare as a family matter, not just an individual matter. So if you're experiencing, or any of you have experienced, there's a mental health issue in your home, that impacts the family. There's a saying, and I have 5 kids, so I know this, that you're only as happy as your unhappiest child, right? So we all know that we're interconnected, and yet the healthcare system fragments us. And so Nest takes it all and says, what does this home need? What does this parent need for this entire home to be successful, whether it's nutrition, behavioral health, housing, all of this stuff. And it's really a no-brainer. It's a duh, Asbel, but it's not how we practice medicine. It's how we did it 100 years ago, 50 years ago, but it's not how we do it today. And that's partly why it costs so damn much money.
So let me kind of talk, and I'm going to kind of pivot a bit here because I wasn't expecting to talk, but I'm so intrigued by your model and what it's doing. It actually dovetails very nicely into physician leadership in a transformative era. And you're one of those. And so I want to talk through, not only are you a transformative leader, you're also a woman leader in a world right now where sometimes a woman has a glass ceiling that sometimes your counterparts as male physicians may not necessarily have that. So talk me through. You've always been here. You've done that. You've done that from a political perspective. Now you're leading a company. You're an entrepreneur. You're signing the front of paychecks. There's a lot that you're doing, Dr. Gee. Talk to me about that experience and why more physicians need to step up and become leaders, not just in the clinical care that they deliver, but really in helping to right size this program. But you've got to understand the healthcare economics of it. If you don't understand the healthcare economics, because healthcare is a business, no matter what we want to see about it, it is a business. So talk to me about how you've done that from your own personal experiences and personal stories.
Yeah, well, first of all, I'll say the glass ceiling is real. And it's real in every aspect of women's professional lives, whether it was in politics for me, where, as you know, I became the political whipping boy for the party that was not in charge because I was of the legislature. And, I would miss a hearing because I had my girls were 3 years old. I have twins, 3-year-old twins when I became secretary. And I missed one hearing in the first 2 months, and I never stopped hearing about it for 4 years. And yet my successor lived in a completely different city, and in fact, didn't come to any hearings and never heard about it once. So it's really a double standard. And that's partly gender and partly politics, I think. Uh, and then second is even in where I am today. So I started this company with venture capital dollars. Those are dollars usually from wealthy individuals who pull their money to invest in new ideas earlier stage. And I then realized only 1.5% of venture funding goes to female founded companies. 1.5%.
Really?
So I am the minority, even more so in where I am today than I was in politics, where when I was in the legislature, when I was in the political issues in Louisiana, it was 11% women in the legislature, which was very low, but still. So that might surprise you. But yeah, I think physician leadership, first of all, I think that a lot of the issues in American healthcare, including, frankly, around reproductive health, there has been so many politicians who have been involved in that, and they really shouldn't be. Healthcare should be, the decisions around healthcare ought to be between patient and his or her physician, clinician. It is a very personal, your body is very personal, your choices around your body and your behaviors are very personal, and politicians should not be involved in those decisions. I feel very strongly about that. And then when they do get involved, as you said, like I was in school, I did not get out of school till I was 30 years old. I have 2 master's degrees, a medical degree. I went to Harvard, Penn, Columbia, Cornell. I know I learned a lot of things, and a politician who's never been to medical school can't make the decisions that I would make with the information that I have. So they shouldn't be involved in it, period. So I do think that physicians need to be involved. And I do think what tends to happen is that you have groups, and you've seen this at the Capitol, groups that have more time on their hands, right? They tend to go to the Capitol and sit there all day and such. As physicians, we don't have a lot of time. So we just assume that things will turn out all right, but that's not always true, right? So you have to be involved, you have to be engaged, because it is, wherever there's money, there's politics. And whenever there's politics, there's lobbying. And so you've got to be a part of that process. So I highly encourage, even from a young age, when I was in med school, I was involved in the American Medical Association and was a student leader. I was then a leader at ACOG. I'm now a member of the National Academy of Medicine. I'm leading a selection of fellows there. So I've always been involved in organized medicine. I feel very strongly that physicians should be involved in that. And that if we, it's kind of like voting, right? If you don't get involved, then we can't complain. Because if you're not going to get involved and you're not going to support, because this is how America works, right? Money buys influence and power. And if you're not going to spend the money or time buys influence and power, either money or time addressing your issues with the political powers that be, because fundamentally more than half of our healthcare is paid by the government, then you may not like what comes out of it. So I do encourage folks to learn about it, to participate. And I've seen, including with my own story, I've seen an individual change things for the better because they had a voice. So and people very much respect. I always say there's nothing more special and such a blessing than to be a clinician, because there's two professions where that's true. One is the clergy, where people just trust you, and the other is being a clinician. And so when I go into an office, people are vulnerable. They want help, and that is a sacred gift, and it should be appreciated. So that and that same voice is become stronger at the legislature. So I think it's really important that we be involved.
Looking at budget cuts? Running out of cash? Look no further than the third payer. You already know the two payers on every claim, the patient and the insurer. But in accident cases, there's a third payer you never billed, and they've been off the hook this whole time. Black Inc.'s TPL Discovery surfaces the third-party liability, so the right payer finally pays. On average, we hit on greater than 50% of the accounts we run. Revenue you already earned, recovered. We'll prove it first. One complimentary run, no cost. There's a third payer. Let us help find them. DiscoverBlackInc.com.
Here's what I was doing while you were talking, because for some reason I get up around 4:10 every morning, and I kind of do like a time where I just sit and kind of do my devotion, read, do some things like that. And I ran across a post that you posted this morning on LinkedIn, and you gave a quote to Han that said, our own life has to be our message. And that resonated with me, Dr. Gee, because I believe it's our stories. Our stories tell people a message, which leads us to, how do we lead with grace? How do I sit down at tables and come to consensus? And how do I get away from this, put a line in the sand, stop listening to you because you disagree with one thing that I said, but you agreed with 9 of them, but I'm going to focus on that one, and I'm no longer going to have dialogue with you anymore. And sometimes we see that in healthcare because you don't agree with one thing, and so everything that you said is there. I'm calling it a grace leader. I grew up as a preacher's kid, whatever, and I've kind of, I believe in the Holy Bible or whatever, and so there's principles that my parents made us grow. And, the power of grace was there, like, son, you should always be kind to others. Nice is different, but kindness is respect. Kindness is respecting others in thought and listening to them. Tell me what you're doing, because that's just what you said here to me. That literally is what you've been dialoguing about. You have lived that life. You're talking about that. I get involved in the processes, and I don't always have to agree. I've seen it on demonstration personally that you've done when you would not agree with something, when you knew what was the right thing to do, and people were politically lobbying and doing other things that were not really the antithesis of the patient. The patient was not a part of it, and you stood firm on principles. Tell me and walk us through that, because that is hard for people to do. And you've been successful about it. And you've pushed through so many different areas. I really would like the audience, because that is where we have got to get in this leadership. We've got the data for days now. There is so much data. Artificial intelligence, I want to talk to you a little bit about that too, is putting that stuff on steroids. Like, we're going fast with it now. We've got doctors more engaged, but if we don't lead this right, and we don't lead it well, and we don't sit down and talk to people, Dr. Gee, I'm afraid we won't solve this problem by keeping the patient in the center. That's where the humanity is. That's the humanity that you're talking about.
That's right. Yeah, I mean, that's the center of my decisions. In fact, I didn't know when I was secretary I'd go start a company, and some of the people that I irritated by doing the right thing would be my customers and would work with me because of it, but I still wouldn't change the decisions I made because, I think, first of all, my mother was an ethicist, my mom, who I lost, and she taught me about the fact that life is about making a difference. And my father, too, who's led 7 universities, he has his name on 500,000 diplomas, Gordon Gee. He has been making a difference, and he does the right thing. And he's had ups and downs, but I see him being brave. I didn't say this, I almost nearly died. My first husband was killed in an accident that I was in, and it put me in a wheelchair. So it's easier, I say, to be brave when you've nearly died, because you realize there's nothing worse than that. And that every day is a gift and every day is not a given. So I think that's true. I think I grew up Mormon as well. My great-great-grandpa was a Mormon prophet. And growing up, I always had a ring on. And actually, my daughter now wears it. It says CTR, which means choose the right.
Mm.
And I do think if you choose the right, then you feel good inside. And you can be an authentic person. If you're not choosing right, we all know it. We have that conscience. We know when we're not doing the right thing. And so I think that's what I follow is, how does it feel? And so I think that that's really important as leaders, that we do the right thing, and we know what the right thing is because we feel what the right thing is. We know what's right. So, and the right thing is usually to care for the person on the other side. So anyway, I think it makes life easier. It makes it, it doesn't always make it, whatever it is, successful. It's brought me challenges, but I have always tried to do the right thing, and it's worked out for me. And I always say, in terms of that quote this morning, when I mentor people, I say, think about your life in terms of what's on your obituary. And so I think about that. It's like, if this activity I want to do, is that something that's going to be meaningful when I think towards the end of my life? Maybe not. Well, then don't do it, right? Because our time is our most precious asset. So I really think that's important, is to live, we all have choices, particularly when we live in the United States of America. We are blessed with many choices. Most people throughout the world don't have these choices. And so being grateful, being optimistic, and being true to our conscience, I think is the secret of happiness.
And that to me is, and that's the mantra. I mean, that if you're a doctor, do no harm. And so what you're saying is, this is how I was raised. And we were always to pursue always do the right thing. I remember my dad taught me that from the time we were kids, me and my sisters, is always do the right thing, always do good, never pursue money. If you do the right thing, God will take care of you. That was kind of his construct. I'm going to pivot over to artificial intelligence. So this morning I'm listening to a podcast while I'm getting ready, and the COO for Claude was talking about Anthropic and kind of doing like these little 14-minute sessions. And so I was just kind of listening to the latest session that they were having a conversation, and she was talking about the good versus evil and Anthropic, and she said that they had done they've got and a lot of this stuff is already published, so we're not talking about anything that's not already out there, but understanding in some of the labs as they were doing so that some of the science around that is they started to train the AI to lie. And once it kind of took over, the neuroscience in it, like all of this stuff that started to come out, and then it would just start lying, and then it started making up stuff that you could no longer control it anymore. And then it started to revert to evil, telling people to kill each other with things like that. And then they did some science lab perspectives where it taught it to lie, but in a confine to not whatever. And so it would just stay in that confines of whatever, and it didn't move down the same way that it kind of got an evil persona to it. And then, of course, they did it where this was a part of the good and the purposeful part of it. And to show that kind of, if you train this correctly, and I think that was the fear of AI when this whole thing came open and they let it go through, and this is where ChatGPT came through like that. Personally, for me as a company, we're all in. We crawled for a while. We kind of tested it, and we had to get all our legal stuff together, committees together. We started walking. Now I'm running, like I'm just running through it, but looking at it from the perspective, like what good can it do? What can it help you with? But there is that portion that is probably going to permeate into healthcare as well, where we're going to have an issue here. And I had Dr. McCoy on, who used to be the former president of Blue Cross Blue Shield. He was on my podcast a few weeks ago, kind of talking about, he has an AI company now, and he's been doing this. It's been pretty, like, he's really into it. It was amazing, some of the stuff and our conversations that we were having. What are you doing, Dr. Gee, from an AI perspective? And what does that look like in the realm of, from your sphere of influence in like administrative processes, from the regulatory perspective? You've been doing stuff legislatively, but now you're also, you're a clinician before you're anything. I heard that loud and clear when you said that. Tell me how you're embracing AI as the leader that you are right now.
Right now we're still in the early mid stages, right? So I've used Claude and I used Claude and ChatGPT. I encourage the whole organization, because what's true is we can just do things a lot faster. It's been a gift in some ways to be able to do that. I think that we have to think about, as we look back to the patient. The patient doesn't really. I don't know how many of you have had to deal with a online retailer and their chat bot. It's pretty unpleasant. So we're not at the point where we really want to talk to a bot about our healthcare. There are companies that are doing that. But yeah, I think this is a game changer for society. I think we have to be very worried about the human implications. If anyone's seen HAL, that's what we talk about with 2001 is, ultimately, will AI have a consciousness to some degree? In other words, does it want to live? Does it not want to die? And what does it want to sustain itself? Does it, have control of nuclear weapons? Does it have control of the electrical grid? These are all questions that I hope that, and I think our politicians are asking and should be asking, as it relates to that. Also, how much energy is this taking? The AI is making money partly on these giant systems that are eating up tons and tons of water in a global climate that's changing. So it is, there's all of that to say. But for healthcare, I'm super optimistic. I think, particularly, let's talk about rural, there just aren't enough people to do the thing. So if we can focus on and that's what we're focused on, is let's let AI do everything that doesn't require that person to person, the intake, the form fill out, the scheduling, those types of things, and then let's let people take care of people. So I am very excited about it for what we're doing. But of course, the meta, more philosophical issues, I think we all have to be concerned about.
And I think that's a dialogue that I think is going to continue to play out from that perspective. But in the frame of healthcare, I think there's a lot of advantages from ambient egg, giving clinicians more of the ability to actually do clinical care versus all the administrative paperwork that's going on. I do know now there's a discussion, and I was having this with Dr. McCoy, like saying, there's going to be payer bots to provider bots, and now the bots are going to fight each other because, as we go through it, and those are going to be just things that we're going to have to but it is going to make things more efficient. But I do think this is one thing that people have not paid attention to, and maybe they're just starting in the periphery. It's going to give some authority back to the patient. And that was a long discussion I was having with several doctors on some multiple podcasts, that now patients have got AI at their fingertips, and they're going to try to self-diagnose stuff. I mean, Dr. McCoy was telling me that. He said, you know what, Asbel, I kind of looked in AI, and he said it about diagnosed 98%. It was right. I went to my doctor, and literally he concluded with almost everything that AI said. And he said it was just a really interesting demonstration that we did through the process. I was doing this myself. I loaded all my labs in. I did everything. And he said it literally almost diagnosed absolutely everything, like radiology and x-rays. It was reading x-rays, and it was accurate on that. And I think that's the enhancements where we can see some of the workforce that we're talking about. We don't have the things that it can help augment that. It's not going to totally replace it, but it's going to help augment some of these workforce shortage issues. And so are you thinking about stuff like that with Nest? Is that kind of the enhancements? I know that's what we're thinking about as a technology company, like all the things that it can support and help to where, where you're having we have a desert somewhere with workforce deserts to get that this can help augment that. Are you seeing something similar?
Well, that's right. Yeah. I mean, when we think about rural care is more expensive. And because people live greater distances apart, and we all know what gas costs right now.
Oh yeah.
So I think that yeah, we are planning on it, right? We are
Sure.
banking on it. AI is our our strategy for making sure that, again, we use our people for the things that people are needed for. And by the way, I think it'll make practicing medicine more fun. What do we all hate? Is all the paperwork, right? We've been talking about it since I decided to go to med school 30 years ago. And so I do think there's a lot of promise and opportunity in this. I think it's just we've got to make sure that we keep patient data safe. We've got to make sure we don't. Again, I do think what is happening now is you've got bots billing insurance companies hiring bots. Right now, it's just raising the cost of care. Oh, my hope is over time it will lower the cost of care. So
Well, I'm hoping it provides that transparency. I mean, we're seeing it played out with the fraud, waste, and abuse initiatives that CMS is currently doing. I had Kim Brandt on my podcast, and she keynoted our user summit a few months ago, really talking about some of those initiatives, Dr. Gee, that they were using, and a lot of AI that's being used at things that used to be hidden to them or took forever to get the data. Now they're able to see it pretty quickly. Tell me, Dr. Gee, what keeps you up? What's one or two things in the healthcare system, running your business, what's going on right now in healthcare that, it's something that keeps you up at night, like thinking, this really keeps me up at night. And I know you're with children doing in very vulnerable populations. Tell me what keeps Rebekah up at night.
Yeah, I mean, Asbel, you mentioned House Bill 1 that just got recently passed. I do believe in the dignity of work. I do believe that the best way to get people healthy is to get them out of poverty. But I don't believe that the best way to get people working is to take their health care away. I don't think that that's an effective way to get people healthy or working. And we've tried this in many states and it didn't work. So we know it hasn't worked so far. And so I am very worried about the work requirements and the paperwork requirements that are coming, because ultimately they are not addressing what I believe is the fundamental issue, which is poverty and lack of access. And so I think we could better spend resources and money doing things like what Nest does, which is to get people out of the emergency room, lower the cost of care. All that being said, I'm rooting for it. If it's going to happen, these work requirements, I'd like them to get people to work, and I hope that they will, but I am very worried about it. I'm worried about the cost of care in general. Our insurance rates go up and up. we need fundamental change, but the problem is that the systems that are the most powerful are the ones that have been built for the ones that are expensive, right? So if you built, there's a great saying in healthcare economics by Romer, it's called Romer's Law. It's a bed built is a bed filled, right? And what have we done? We've built a bunch of beds. We want them filled. That's partly why primary care isn't highly paid as other specialties because it's not, it's not getting people into beds; it's keeping them out of them. So I worry about that, but I think I'm also hopeful that, as we talked about earlier, technology will solve some of these problems, and that there will be new ways to make money and to do things in business that will allow everyone to take advantage of this AI revolution. But I also worry about that. I worry about this is putting a lot of money into very few people's pockets, and the jobs that are going to go away because of AI. Who's going to, is that money? People say, oh, it's going to go to everyone. Is it? Or is it going to go to Elon Musk and a few people? I mean, I worry about that too. What are our kids going to do? The great thing I tell them is healthcare is wonderful because there will always be a need for nurses, psychiatrists, primary care, until we get robots who can do it as well as we can, which will be a very long time from now. You will have job security.
It's a recession-proof. It's almost a recession-proof industry right now. There's always going to be a need for it. It might look a little different than it looks right now in a few years, but it's recession-proof. And I agree. It's very interesting when I ask the question a lot, general theme, regardless where you land politically, regardless what you think. Generally, I hear the same thing. It's very interesting to me that, people deserve health care. Health care is a right. Most people don't realize that, but when you start talking to them, they might say, well, no, it's not a right. Healthcare is not a right. But when you start getting down to the granular, they admit and they're like, well, you have a point. And I'm like, so healthcare is a right. And so we have to have a fundamental discussion about that as Americans. And so I appreciate you bringing that up, Dr. Gee, because these are real things that are keeping people up at night, and physicians, those that are on the front line doing the care like you are. And you just have an acumen that supersedes a lot of physicians that are just out there doing the work. You also understand how the politics work with it, the economics of it, and it's amazing what you're doing. Just as a last question, light, we've been really talking about a lot of stuff here. Give me something light, like tell me something about Dr. Gee that maybe people just do not know about you.
Well, I love, like you, Asbel, I love fashion and design. So if I had another career, one day I'm probably going to have a side gig where my daughters are very, very artistic, and I want to have a store that's like fashion, design your life, coaching, I would love to have my own show. I would have a blast. In fact, our life could be a show because we really have a wild
I can
time.
see that, and I can see that in your office as well, that the artistry comes out, and you're creative. And when we're creative, that means we adapt, we can innovate, and it's the same thing with me. I let the art speak through me. Like my brain just goes that way from music to stuff like that. Well, I did not know that about. Well, that's a fun little fact that we're going to leave here as well. And Dr. Gee, I say thank you so much for joining me and your perspective on this, and keep doing great, incredible work and innovative work that you're doing right now. And it's going to transform our healthcare system, what you're doing.
Thank you, Asbel. I'm so delighted to spend this time with you.
Absolutely.